From KGW News, this is a special edition Coronavirus Q&A.
And thank you for joining us for KGW Q&A. This entire half hour will answer your questions about coronavirus. And today, parents and students got an answer about the rest of the school year. Kids in Oregon won't go back. They'll continue with distance learning. Pat Doris explains what this means for students and parents and families.
The governor said distance learning will continue in a variety of different forms depending on the strengths of each district, and that seniors that were on track in mid-March to graduate, they had passing grades, they will automatically graduate. It's almost impossible to keep kids apart in school settings, and so social distancing would be out the window. That played a big part in the governor's decision.
You know, not going to school, working from home, so much has changed. And you have a lot of questions as we think about moving forward, like what happens when someone recovers from COVID-19? Could they still be contagious? Our guest tonight is Dr. Claire Wheeler, a public health specialist with PSU and OHSU, and she has been answering so many of your questions. You know, Dr. Wheeler, what do we know about a person, who is over the symptoms? Can they still pass it on?
Yeah, that is a question that people are looking at really carefully right now, because there are some cases of people who have gotten sick, gotten well, and tested negative, and then come up with a positive test for the virus. And a lot of those cases happen in China, but it's possible that that phenomenon can happen here. And so we really don't know whether or not these people got reinfected or whether there was a false negative test of their hospitalization, because the test involves going very, very deeply behind your nose. It's a rather unpleasant experience. I mean, it's short and quick, but it's, not fun. So it's possible to not catch what viruses might still be there in the back of someone's nasopharynx. So we don't know, whether this is a lack of immunity or if it is a false negative or a reinfection, but we do know that it appears that people can be contagious after they recovered.
Okay, interesting. And here's another viewer question. This one is from Vicky. So she asks, is it safe to send a care package to an elderly person in residential care? She said, we want to cheer them up with snacks, gifts, puzzles, books, but they don't, she doesn't want to put anyone at a greater risk. How would you answer that?
I feel the same way. I love this question, and I'm actually inspired by it. The first thing I would do is, if your elder is in some sort of residential place, I would get in touch with them first and find out if they're going to allow packages to be delivered, and from whom they will allow packages to come into the residence. But if it's all okay, you have two options. You can go shopping and get stuff for your elder. That is a little more complicated, because then you've got to bring everything home, cleanse it, pack it, and take another trip to ship it. So I would recommend going online and finding a variety. There's all kinds of different websites that actually are already marketing COVID care kits for people with all different interests. And I think that's probably the best way to go. And another option is you don't have to send things, right? You can order someone a subscription to a fitness app or an ebook or all kinds of things that isn't actually tangible but still can show that you care.
Great idea there. And Peter asked, this is a great question. He emailed us. He said, does standing in line outside of a grocery store, so we see video of people standing outside of a grocery store, outside of Costco, for extended periods of time, does that increase the risk of exposure to airborne coronavirus?
Okay, so if you're standing outside a grocery store and no one else is there, and you're not wearing a mask, your risk is extremely low. In fact, probably about pretty much zero. If there are other people and they're maintaining this to 10 feet of distance, then they still should be wearing masks. Airborne transmission indoors appears to maybe be possible. Outdoors, we don't have any evidence that is happening to any large extent. And the main reason to wear that mask while you're in line for the grocery store is to protect everyone else around you, so that everybody's just kind of maintaining their own little environment around their own face and nothing is getting out. And I would also remind people not to touch anyone or touch anything, just kind of keep your own little private bubble. But it's not so much about catching it through. transmission while you're outside as it is just keeping your environment around you clean from whatever's inside of you.
Right. Okay. Well, Dr. Wheeler, thank you so much. You always give us such great answers. Thank you for answering all of our emails, because we send this woman dozens of questions every day. So thank you, Dr. Wheeler. You are helping so many people.
Thank you. It's an honor.
Okay, and at any time you can send us your questions. The number's on your screen. It's 503-226-5111. If we don't get to your question tonight, we'll be answering your questions right here at 7 o'clock, Monday through Thursday. And up next, our Verify team finds out if we can use 3D printers to make protective equipment for doctors and nurses. But first, a viewer noticed that golf courses are crowded and wanted to know why they're still open. Well, the answer, golf courses are allowed to be open in Oregon under the governor's order. Many accept payment over the phone or online, so you are not paying in person. And some golf courses are just doing one person per cart, or some are avoiding the cart altogether. Let's answer some viewer questions. So Lindsay wants to know, we have heard in the news that people are turned away from testing. Are we counting the number of cases that are exhibiting symptoms but not being tested? Why are these people being turned away? Thank you again, Lindsay Hardison, for that question. So as long as testing materials are limited, we have to prioritize who gets tested and who does not. Right now, it's healthcare workers, then people with symptoms or caring for people with symptoms. We need test results for everyone if we are ever able to understand how to best respond to the outbreak. So people are not being turned away because they should not be tested. They are being turned away because we have to prioritize those who are most likely to be infected so we can get them into isolation. All right, our next question. Some of the countries that were able to stem the tide early on, like Singapore and South Korea, are seeing new cases. Why is this happening? So doctors say it's important to remember that the bump we've seen so far does not appear to be a second wave. Without rigid travel bans, there's always the risk of a resurgence when infected people enter a country. Although many Asian countries have instituted or reinstituted travel bans, including Japan, banning people from the U.S., it seems that when those restrictions are relaxed, cases start rising again. And another question we've been getting a lot, should we still be cleaning mail? Thank you, Jean, for that question. And yes, experts say you do want to wipe down packages and wipe down mail and wash your hands after opening or handling either of those things. Thank you so much for sending in your questions. For more questions that we've already answered, go to kgw.com/answers. We're dedicated to answering as many questions as we can every night at 7 in our KGW Q&A show. And since the CDC recommended them last week, you're probably seeing more masks. So why should you wear one when you go out?
Show that people with COVID-19 can not show symptoms, or they can have mild symptoms, but still spread the virus to others. If we wear face coverings, we decrease how many droplets we release when we sneeze, cough, or speak. If we have no symptoms or mild symptoms, wearing a face covering will help us from unknowingly spreading infections to others. So, in other words, when I wear a face covering, I protect you. And when you wear a face covering, you protect me. This is one more thing that we can collectively do to protect each other. The most important step to protect yourself and others is to continue to follow the physical distancing guidelines. Face coverings are not a replacement for this and should not give people a false sense of security.
And the CDC stresses medical masks should be reserved, of course, for healthcare workers. And with the shortage of masks, we've had this question a lot. Can 3D printers be used to effectively make them? Our Verify team answers that.
A viewer sent us this email, quote, "I saw something saying that 3D printers can be used to make masks for healthcare workers." She then asked if everyday people with 3D printers can step up and help. Let's verify.
My name is Eric Bubar.
My name is Eric Milani.
My name is Philip Bowie.
My name is Madison Bondock.
These four are helping us answer the question. They're members of a group called eNable, which has volunteers across the country. They've gathered 38 of these 3D printers. Each one can create a face shield in about 45 minutes. Already, they've distributed more than 850 of these face shields.
It's fantastic.
Professor Eric Bubar from Marymount University recruited some of his students and alumni to join the cause. He says the face shields have gone to maternity wards, hospice facilities, jailhouses, and in hard-hit areas like New York City. Whoever needs them.
Just to get some of the messages that I'm getting from people that are using this, people are in tears. One of the doctors in New York City said these are better than gold up here.
And these shields really have been in high demand. You see, many doctors and nurses are being forced to reuse their masks, and these shields can limit the damage. So we can verify, yes, 3D printers are being used to make face shields.
Giving people hope and just showing them that there's still good things happening in the world.
I don't think we're the heroes. I think the doctors are the heroes. I think of us more as, if you've ever seen the Spider-Man movie, we're kind of the guy in the chair that's kind of supporting the heroes. We're the Alfreds, and they're the Batmans.
Up next, is there a chance we could see 2 rounds of stimulus checks? We'll have the answer. First, if you're wondering how much you'll get from the first stimulus package, we've made it easy. Text the word check to 503-226-5111. We'll send you a link to a stimulus check calculator. Welcome back to KGW Q&A. Financial worries dominate many of the questions that we're getting, including will we see a second round of stimulus checks from the federal government? NBC News correspondent Tom Costello weighs in.
I think that's clearly something that Congress has to consider. And listen, they have demonstrated that they are willing to spend the money that they need to save the economy. And make no mistake about it, that's what we're talking about. We're talking about saving the economy, saving jobs, and when you save jobs, hopefully you keep people in their homes. They don't lose their rent or being kicked out, in other words. They don't lose their mortgages. They're able to feed their families. I mean, these are the stakes. They're very high, and Congress knows that, and the administration knows that. But you're right, the $1,200 check that every adult is supposed to get, every adult who makes up to $75,000 or $150,000 for a couple, that money likely will only go so far. And for some families, only a few weeks when you're talking about paying for everything from the car to the insurance to the kids' braces to the food, etc. So this is clearly an emergency, and it is why the administration is pushing as fast as it can to get that small business money out, and it's trying to encourage businesses, all businesses, to retain their employees, keep their employees, pay their employees, so that hopefully families aren't in this dire emergency.
Great information there from Tom Costello. Some of you have been asking about chloroquine. It's used to treat malaria, but can it be used to treat COVID-19? Here's the answer from PSU chemistry professor David Payton, who specializes in the drug.
Oh, that is still up in the air. There are multiple trials that have been done, multiple reports of dosing patients, which may or may not be viewed as a trial, but the results depend on which study you look at. For example, there was an early one from France, which looked quite positive, but on second glance, there were a number of what people considered flaws with the data. There are more recent ones, including one that just came in a few days ago from China that made it look quite a bit more hopeful. So we hope, but we don't yet know.
Up next, we are having absolutely beautiful weather right now, so you wanted to know which parks and trails are still open. Morgan Romero has the answer for you. But first, Bonnie wanted to know if it's true that Advil can cause the virus to turn into pneumonia and if you should only take Tylenol. The answer here, the World Health Organization and other leading agency, they say that there is no evidence to support the suggestion that ibuprofen might worsen the symptoms of COVID-19. We've been told to wash our hands often, and you asked why it takes 20 seconds to wash off germs. Here's Sonia Zod with the answer.
Good old soap. For years, it was good at 2 things: cleaning and giving kids a reason to avoid curse words. Ugh. Let's talk the former, not the latter. By now you've heard about the 20-second rule. Wash your hands with soap and warm water for 20 seconds. But why do we do that? Well, here's why. Take a close look, a really close look at soap, and you'll see this, a molecule. One side loves water, the other loves fat, hates water. Put soap and water next to oil, let's say, and the soap molecules go to work. Water-loving side goes toward water, fat-loving side goes toward the oil. It's why soap does such a good job of cleaning your gross, grimy dishes. Now, let's see it interact with the novel coronavirus, named because of those weird-looking things sticking out. Those things allow the virus to enter your lung cells. That's a bad thing. The outer layer of the virus has a weakness, the water-hating, fat-loving side of the soap molecule. See that? The outer layer, scientists call it a membrane of oily lipid molecules. That outer layer is no match for soap. Each one pries the membrane apart, exposing the water-soluble inside of the virus to, yes, water. Eventually, soap forms a bubble around the bad stuff. Scientists call it a micelle. Add more water, and it all washes away. So why 20 seconds? Look at your hands. No, seriously, look at your hands. See all those lines? Viruses like to get in those. More soap time, more time to clean those cracks. Hand sanitizer, yeah, it works too. Thanks in no small part to alcohol, which through a sciencey term known as denaturing, works to destroy the virus. Key is to have at least 60% alcohol. So yeah, that vodka in your cabinet probably won't work. Save that for something else, like say, celebrating the really cool things about soap. So get going, start counting. 1, 2, 20 seconds should do the trick. Yay, soap.
That's great information. And you know, with the beautiful weather this week, you're asking which parks and trails are still open and where are there restrictions? Well, Morgan Romero has your answer.
We love our parks in Oregon. They're objectively some of the best. So I'm going to tell you what's open and what's closed in Portland. All parks, trails, nature areas, and public golf courses are still open. But some parks, like where I am at Mount Tabor, have gates up and they're closed to through traffic to discourage overcrowding. Playgrounds, athletic fields, skate parks, and sports courts like basketball and tennis are off limits through at least April 28th. Indoor recreation facilities like community and arts centers, pools, the Portland Tennis Center, and golf clubhouses are also closed. All parks and rec events are canceled through the 28th too. It's getting tough to stay far enough away from people at Portland parks when the weather is this nice. So starting this week, park greeters will be out at some Portland parks to enforce social distancing and teach people what to do. Here's how to enjoy parks and trails safely. Stay at least 6 feet from others, visit places close to home that aren't crowded, don't go out in groups, and limit outings to people you live with. Stay home if you feel sick, wash your hands before and after hitting trails or parks, and announce you're on a trail to warn others. We have a whole list on KGW.com of what's open and closed in the Portland metro area, at beaches, on the Oregon coast, and in public lands around the state.
All right, Morgan, thank you for that great information, and thank you for joining us for KGW Q&A. If you still have questions, I bet our past stories could answer them for you. Go straight to KGW.com/answers to see all of our past Q&As. We'll see you back here tomorrow at 7.